according to the Ghana Health Service. Even though this condition prevails in all the regions of Ghana, the northern region has the highest prevalence. Far off in the northern region's Kpandai, Niwuluga Balinbie, who is in her 50s, shares a grim story of attempted suicide. She has been leaking both feces and urine for over 20 years.
When I was affected by this medical condition, I was taken to so many places and given different types of treatments, but none worked for me. Now, it has even become worse. My neighbors and even my own children don't allow me to draw closer to them because they say I stink. Children make fun of me whenever they see me. Nobody eats my food. My own grandchildren are prevented from eating my food. Because of my situation, I think suicide is the best option to get me out of this misery.
She's never had the opportunity to undergo fistula surgery. Her close opportunity was in December 2019 when she was assessed and scheduled to undergo the surgery in 2020. But that was never meant to be because of COVID-19 and the imposition of restrictions in movement in March when Ghana recorded its first case on the 12th.
I was so excited when taken to the hospital because I knew I was going to be healed. I always tell my son to call you for me. But he complains of not having airtime, and I don't have a phone. I was told the reason you couldn't come for me was because of the virus.
She has been battered by poverty over the past years, and the COVID-19 pandemic has exacerbated her plight. Few minutes into my interview with her, Niwuluga started leaking. Rahinato Isahaku is a senior nursing officer at the Buya Health Center in the Kpandai district. She has been mobilizing women for fistula surgeries for more than 10 years. In December 2019, she was able to facilitate the transportation of Niwuluga and other fistula patients in the Kpandai district for assessment at the Tamale Teaching Hospital in the northern region of Ghana.
It's a condition that they know themselves. So if they see that they are all suffering of the same condition and seeing one to be repaired, they try to find out how did you get the solution to your problem. Then that fellow is referred to come and see me. And if that fellow comes, I also try as much as possible to let them get a solution to their problems. It wasn't easy because the last time I sent them was when the Czech Republicans were coming to do some free surgery in Tamale. That was in December. So they all came with the help of one Mr. Edie. Sent them, we bused them to Tamale. And when they got to Tamale, they only assessed them and said they should come back and they will repair it after the new year. So I was preparing them to come for the surgery after the new year, only for this corona to pop in. So I personally visit them to reassure them and also get them the diapers and some detergents to be washing their things.
Rahinato says she is inundated with calls for help from these women on a daily basis. At the heart of these calls is the question, when will they get the operation that will heal them, just like other fistula survivors?
Actually, I said they wouldn't have confidence in me again. Or they've been suffering this condition and thought I was the solution to their problem, only for them to be turned out and finally corona has come to pop in. So how soon, we really don't know. So even visiting them is always a challenge.
Beryl Ernestina Richter's report for Joy News.